Today we're going to talk a little bit about the heart. The heart is a muscular organ about the size of your fist that sits in the middle of your chest, in the thoracic cavity, just below the sternum and a little bit off to the left. During a single contraction, the heart will pump the blood through all four chambers of the heart. Blood flows into the heart through the superior vena cava and the inferior vena cava into the right atrium. From there, the blood is forced through the tricuspid valve into the right ventricle. From the right ventricle, the blood will then flow up through the semilunar valve and out into the lungs for reoxygenation. Once it's coming back from the lungs, it's going to come in through the pulmonary veins into the left atrium, down through the bicuspid valve into the left ventricle. From there, the oxygenated blood will be passed up through the aortic semilunar valve and out into the body. And the whole cycle repeats and repeats 60 to 100 times per minute every single day. So what causes our heart to beat? Our hearts have their own automatic electrical system, and that has its own backup. And even though it's not quite as efficient, it will still keep you alive. The automaticity of the heart starts in the SA node, which is located in the right ventricle. The SA node is considered the pacemaker of the body. If something scares you or otherwise stimulates the sympathetic nervous system, your heart rate will increase, while certain other systems, such as your digestive system and your urinary production, will decrease. This is your fight or flight mode. Likewise, if the parasympathetic nerve stimulates the SA node in your heart rate will decrease. The stomach will work more, your pupils dilate, and your pelvic nerves are innervated. This is known as the feed and breed mode. After an electrical impulse passes through the SA node, the electrical impulse will flow easily through the rest of the heart via the intranodal pathways. It then reaches the AV node, which is located at the AV junction, and that impulse will go into the AV node, which goes down the atrioventricular septum through the bundle of His, and then further divides into the Purkinje fibers. So all in all, air goes in and out, blood goes round and round. Any deviation is a bad thing.